Hey, and we are now live. So, hello everyone, a warm welcome. This is Phil from Let Us Talk It. We do this weekly Zipinars for the benefit of everyone. The Let Us Talk It Zipinars is an initiative for free knowledge sharing. So, this is founded by Cogent Integrated Business Solutions. So, they are an IT company based in Detroit, Michigan, and all they wanted was to give back to the community and impact the world. And the best way they found out is to share knowledge for free to each and everyone because knowledge is a powerful tool, but sometimes it is an expensive one. In order to impact the world, they decided to create this webinar platform, which we call Let Us Talk It Zipinar. We call it Zipinar as we try to zip in two topics in one webinar. So that is to lessen the time consumed as everyone is busy working on all those, but maximize the information and the knowledge that we share to impact the world. So we bring two topics and two guest speakers, seasoned guest speakers that are very willing to join us in this initiative in impacting the world and sharing knowledge for free. All right. So here, I'll be introducing the first topic and then the first speaker, and then we'll do the second topic as well on the second part. So be with us, join us in this initiative, and share this work as well in order to have the knowledge impact much further and have more visibility for our guest speakers that the value that they share as well will reach more people. So the first topic is reimagining the patient life cycle, a CIO's perspective. So hospitals today must go beyond episodic care and think in terms of lifelong digital engagement. And in this session, this will offer a strategic lens into reimagining the patient journey from first contact to follow up through scalable digital infrastructure, AI adoption, and workflow design. And at the heart of this vision lies a simple but powerful mantra, the four KPIs. So keep patients informed, involved, inspired, and invested. And together with our speaker, we will explore how these four KPIs can drive better experiences, outcomes, and long-term trust in care delivery. And today with us is a CTO of Top Grep Tech Private Limited, where he leads AI powered digital solutions, enterprise clients with more than 24 years of experience in technology, leadership, and recent success driving digital transformation at St. John's Medical College Hospital, and brings a unique blend of strategy, systems thinking, and patient centered innovation. An IIMB alumnus, certified independent director, and a BH digital health assessor, and a BH software assessor, and Lean Six Sigma black belt. And let help me welcome Sir Anthony Prem for the first topic that we would present today. Hello, Sir Prem. How are you? Thank you for joining us in this initiative.
Thank you. So I'm doing great, and thanks for a very nice introduction. And can I share my screen now?
Yes, sir. You can share your screen, and yeah, we can go with the topic.
Yes. Are you able to see my screen?
Yes.
Cool. So hello everyone, and nice to be part of this Zipinar, as Phil would call us. I'm just going to talk about the transforming the patient journey, particularly in the Indian context, and how the industry is shaping up, and what the hospitals need to be prepared to do in order to get the trust of the patient, right? So that's a topic that I'm going to deal with now. So first hand, let's look at the industry today, right? So these are some projections by the BCG as well as the B Capital Group. So we see a quite of potential today in terms of the healthcare industry, right? So there's going to be a phenomenal growth by 2030, right? And what this has also done is the hospitals are now focusing into micro markets, which means that they are moving away to tier two, tier three cities. So to set up their infrastructure there so that the healthcare can be provided to the needy. And the third point would be most branded hospitals are starting up in a very small way, right? So they don't invest largely for a 600, 650 to 1,000 bedded hospitals, but they are looking at 100 to 300 bedded hospitals today, right? So we are at an inflection point in, I would say, the healthcare industry in India. So this is just to give a perspective of, how the uh, bed care is kind of stacking up in India, right? So we are about 15 beds per 1,000 population. So with the hospitals kind of setting up their infrastructure in the tier two, tier three cities, I think this is going to go up, right? And it is also going to drive the, I would say, competition between these hospitals. So again, looking at the projection from Statista, we see a steady growth in terms of the specialty and the treatments that are there for the inpatients. And the same way for the outpatients as well. But what is kind of surprising to see is if I look at the percentage change in terms of the revenue. So we are basically drawing a flat line in years to come. So this is kind of an alarming thing for the healthcare industry. And this would be the growth drivers for the hospitals, wherein every other hospital would be competing to build a patient life cycle value, right? So that's something we are looking at going forward. And this is for the outpatient as well. So if you look at the growth of hospitals in India, so every year there's a 1% growth. And what I would say is patient engagement through digital touch points, we will witness a positive PLV over a period of time, right? So these answers to the question, like, why the hospitals are being set up in the tier two, tier three cities. Okay. So when we talk about patient life cycle value, so there are four dimensions to it, right? So one is the clinical value, where the patient always sees an improved health outcomes, right? Like a preventive, chronic, or an acute care. Then second, we look at the economic value. This is for both the patient as well as for the hospitals to see how efficient and quality services can be given, right? Through constant follow-up, checkups, telehealth, and pharmacy, etc. And the third part is the relationship value, where we kind of the patient acts as a referral. When a patient refers the hospital to somebody else, which means that the patient has already built trust with the hospital, right? This is one of the potential areas for the patient as well as the hospital. And the third part is the capturing of data. How efficiently, how accurately are we capturing the data? So these are the four dimensions that drive the patient life cycle value. So if you look at the patient engagement value chain, so you have a plethora of processes and activities that a patient has to go through, right? And if you look at in India or if you look at across the world, none of these processes are completely digital. Like some are 50%, some are 80%, some are, I would say, 75% or even 20%. So the point is every hospital today has to digitize all these processes so that they bring in a continuous connectivity to the patient, right? So we are moving away from an episodic care to a lifetime engagement of the patient. So to support those processes and activities, you have a plethora of software that is kind of contributing to those needs, right? So you have electronic health records, you have a back office financial system, you have the PACS, which is for the X-ray, then CT scan images, then you have a laboratory information system, pharmacy information system for selling the prescribed medicine, then you have a clinical decision support systems, and so on. So ideally, you have a complex ecosystem in the hospitals today, right? Some of it is connected, some of it are not connected. There are a little plethora of reasons why this cannot be done, right? And today you have different endpoints. You have laptops, you have desktops, you have mobile phones and tablets. So all these have to be seamlessly used in these interfaces, right? And some are hosted on cloud and some are hosted on-prem. And there's a lot of security things also which come up when we take up these things, right? So how do we kind of make all these things work in tandem, right? So if you need to drive a very good patient life cycle value, then all these things have to talk to each other. Okay. So now enter Metcalfe's law. If you add more systems, yes, you have more complexities. Now the benefit here is connecting all these healthcare systems, right, can deliver a huge value for the patient and for the hospitals and for the doctors. So how are we going to go about it? And how are we going to measure this? In a way, this can be effectively used to enhance the patient experience. Okay. So if you look at the world today, so we are moving from a prescriptive, which is basically if I feel sick, if I fall sick, I go to the doctor and I get some medications, then I treat myself, right? There's the first part. Then second part is we are moving towards a preventive, which means that I go to a health checkup. So I have the doctors assess me based on certain symptoms, then I continue the treatment, right? So we are moving to a predictive, which means that with a drop of a blood, I should the doctors or the technicians will be able to predict what is the lifestyle diseases I might get into, right? And finally, we are also moving into precision medicine, where the I would say the accurate dosage is prescribed based on your history of uh, medical health, right? So when we are moving from a prescriptive to preventive to predictive and precision, so the last two part requires a lot of data to be captured, right? And the data has to be standard, the data has to be accurate so that the decision that is given by the AI driven systems is accurate and you have a positive outcome to it. Okay, so this is a very profound statement. In God we trust, all others must bring data by Edward Deming. So, but if you look at the data types in healthcare, there are so many, right? You have patient data, you have clinical data, you have administrative data, operational, and so on. But how are these things maintained today in most of the hospitals? So it is not only in India, it is across the world, right? So you have different formats, you have different colors, right? And you have different standards. So how are we going to use this data to move from a, I would say, preventive to predictive to precision? So these data have to be accurate, right? And parallelly, when we reach to preventive and precision, which means that we are bringing more value to the patient. So we are bringing a positive outcome to the patient based on certain predictions, right? So now hospitals have been adding systems, applications over top of each other. Now we are into Metcalfe's law syndrome, right? So typically we kind of ignore the complexity of interoperability. We ignore the complexity, or we ignore the quality of data, and also we basically ignore the need of connected systems, right? So how do we plug this all in, and how do we measure that the patient gets the right treatment or patient gets the right outcome of his health issues? So, but if you look at all these things, right? So generally in India, as I said, we are going through an inflection point. So most hospitals are moving into digital transformation. So it is a strategic initiative, not a project, right? Like implementing one application. It is a series of applications so that they get into so that they can provide an omni-channel information to the patient as well as the doctors for treatment, right? So it's more of creating a value in the business of healthcare. So when looking at healthcare, most of them would kind of say that a patient is a customer, but patient is not a customer, right? So if you look at a patient, always engage in a long-term trust-based relationship. Where customers, it is more of an exchange of service based on certain payment or by convenience. So when we are looking at a patient life cycle value, it is more to do with how do we engage the patient over a period of time. So what are the growth enablers today that we are looking at improving for the patient? One is, how do you improve the accessibility to healthcare? And second is, how do you enhance the pre and post visit experience of the patient, right? So once the patient visits the hospital, what are the communication that go in? What are the follow-up activities that is being done? And how does the patient is engaged in when the patient is inside the hospital, right? And also, how do we address the unmet needs? A typical example of an unmet need could be hospitals in India. The bigger hospitals are in cities, and the patient travels at least 200 kilometers from his hometown, comes to the hospital. Then, if he doesn't find the doctor available at that point in time, he goes back. Right. So this is basically an example of unmet need. How do we address all these things? Right. And how do we bring down the cost of care? Right, cost of care, it goes for the patient as well as for the hospitals. And also, how do we address the lack of resources? So these are the enablers that we are looking at today to bring the patient life cycle value. So now let's quickly jump into the 4 KPIs on how do we measure the patient life cycle value. Right. The 4 KPIs, I would say, keeping patients informed. Right. It is more of informed patients or empowered patients. Right. How do you keep patients informed about a new treatment? How do you keep patients informed about their upcoming appointments? Right. How do you keep patients informed about the medication the patient would need to take, right? All these are basic and engaging activity that needs to be done so that the patients are kept informed of how their treatment is progressing as well, right? The second would be the keeping patients involved. How do you engage the patient? So for example, let's say the patient visits the doctor and the doctor prescribes certain medicines. Now, the doctor will always say, come back after 2 weeks, come back after 3 weeks, or come back after your dosage is over. But is there a mechanism where we can engage the patient on a day-to-day basis, right? So have you taken the tablet? How are you feeling today? Are you still having the same pain or are you still having the same problem? So these are some of the things that we need to make sure the patient is engaged so that you attain a patient life cycle value for the hospital. So the third part is keeping the patient inspired, right? So there might be similar cases of patients who got cured in the hospital. How do we keep that communication alive? So how do we kind of bring confidence to the patients to inspire them, right? And the last part is keeping patients invested. So invested patients are committed patients, right? So you need to educate the patient constantly on the preventive care and all that, right? So that they continue the medicines and to see a positive outcome. And once they see a positive outcome, they stay invested. And they also kind of refer the hospital to somebody else as well, saying that the treatment is good here, so why don't you visit this hospital? So this is the way to build trust between the patient and the hospital. Okay. So a quick a look at the pre and post-COVID, right? So pre-COVID is more of a fragmented episodic care. Access disparities are there. Then you have a very low penetration of the digital medium. Then there is also cost burden because we see most bigger hospitals are in cities, right? Not out in tier 2, tier 3 cities. So the what we have undergone post COVID is phenomenal, right? We have an accelerated digital systems, right? And the patient awareness has increased due to the digital media, and hospitals are investing in new infrastructures. And plus, the government is also driving these initiatives, right? So that the four KPIs are addressed, right? And if you look at India, so we have grown tremendously in terms of digital payments, right? So there is no cash transaction, I would say. And then lastly, the rise of AI and analytics. Now, this is going to be the major growth drivers for the hospitals. So I've just put down few use cases here. So these are some of the low-hanging fruit a hospital would need to look at today. Patient report generator, then voice assistant for insurance, for quality, for feedback. Then you have booking assistant. So all these are an introductory, I would say, a technology on AI to the hospitals, which are the low-hanging fruit, which could also build confidence and trust to the patient on how the engagement is done by the hospitals. And this is a very important slide because government is also driving the entire health industry um, towards making sure the quality healthcare is provided to the citizens, right? So you have the Ayushman digital machine, which is kind of ensuring all the applications that run in the hospitals are integrated to one particular data center where the patient's details are available as a single source of truth. Then you have I would say the Data Privacy Act, which is coming, DPDP Act, which is kind of governing the consent of the patient as well, so that no private data is pushed to public platforms, right? And you have the NABH, the accreditation board for hospitals, where they kind of look at what is the maturity of digital health system that you have in the hospital. So I'm one of the assessor for the digital health, and what we are going through today is we are trying to encourage the hospitals get into digital platforms, right? So this could basically bring all the data in one place, and so that at a single shot we could look at what are the different um, treatment that is happening across India, right? And if there is any correction, if there is any certain improvement that needs to be done, all these can be channeled through the government, state governments, and the district order so that the patient gets the right treatment. So this is my last slide, and if you see, the information is the determinant of health, right? So you need accurate data at the accurate time so that you get positive outcomes in terms of the health. Right? So once you get there, then your health outcomes depend on the trust between patients, providers, and systems, right? So health moves at the speed of trust. So hospitals should concentrate on building trust through the four KPIs, right? Which also says that you need to have a completely connected system so that you can give positive outcome to the patient. Yep. So I think I'm done with my presentation, so I can take questions.
Right. Thank you so much, Sir Frem. That was great points that you have brought up with your topic, and with all this like technologies, innovations, and like usability. It's always like one thing maybe that's making the people curious is always the data privacy, right? So it's great you mentioned about the data privacy because it's always what concerns, especially the ones who's not very like fond of yeah like using technology, right? So those who need more of like healthcare attention, plus they're not very savvy on the technology part, so it always concerns them how their data is protected. So it's great that you have mentioned that one. And yeah, uh anyone from the attendees are we are now open to for the questions. If you have any additional inputs or opinions, you may put it on chat, or you can raise your hand, or even Dr. Renee, you can actually put up a question or share your insight as well. Okay, so checking online our live section, we don't have any questions just yet. And for those who are watching live, thank you. You can also share our videos, or if you have questions on the later part, or if you will just be watching the recorded part, you can still leave your questions on the comment section so we can bring it forth to our guest speakers. All right. So anyone from the attendees would like to ask questions? All right. I don't see anyone just yet. So anything that you'd like to promote your prem, like where they can get in touch with you to inquire more information about this process, and yeah, to keep in touch, how they get in touch with you, and do you have any upcoming events or online events that you'd like to invite everyone?
Not really. So I would basically keep my audience posted on LinkedIn, so they can follow me on LinkedIn.
Okay, perfect. So you can just type Prem A on LinkedIn, as her Prem is very responsive. So you can send a connection invite and a dedicated message maybe to set up your intention. And yeah, you can bring in your questions offline or personal to him if you wish to keep it personal. All right. So I think that takes care of the first topic that we have today. What a wonderful first session, first part of the session, definitely. So if in case anyone from the attendees would come up with any like any questions anytime in between, just put it on chat and make like just let us know who you'd like to address the question to, and yeah, our guest speaker will take care of it. All right. So thank you so much, Prem, for the first part of the session. Wonderful. And we'll be moving to the second part of today's talk. All right. So the second topic is about job readiness journey from academia to industry, upskilling and reskilling for tech industry. Now, this topic is very timely because a lot of fresh graduates have come up to the market right now and wanting to be hired and, yes, getting or landing their dream job. And this topic will definitely give insights, additional inputs, and how you're gonna go around with what you are looking for. And also, this session will help us explore how automated job ready reskilling and transforming the tech talent pipeline, and discover Ivagam's model, combining instant browser based hands-on labs, AI-powered learning assistants, and franchise-led delivery to build industry-relevant skills fast, with a role-based learning paths, real-work environment simulations, instant feedback and placement assistance, and learners can bridge the gap between education and employment, gaining the equivalent of 3 years of experience in just 4 weeks. How wonderful! This is already a great shortcut. And to deliver this topic is Dr. Renee, MCA, MBA, MPhil, IIMB, and PhD, is a C-suite full-stack executive with more than 23 years of experience in IT and education, and leading diverse teams across geography, with redefining new levels of customer-centric engagements in a variety of highly competitive, cutting-edge markets and fast action paced environments. And her strengths are technical direction, setting up outcome driven processes like improving NPS, drive behavior via metrics to measure and optimize, and strong people skills. And also an angel investor, advisor, and loves spending her weekends with people or startups who needs help. And without further ado, let's help me welcome Dr. Renee for the second topic. Hello, Dr. Renee. Thank you for being with us.
Thanks, Will.
For the second part of the
Super
session.
excited to be on this show. Thank you.
We are very pleased as well and honored So yes, we can go ahead with your topic.
Okay, just give me a moment. I'm sharing the screen.
Yes, for sure.
Can you see my screen?
It's loading, and yes, we can see your screen now.
Full screen?
Yes, full screen.
Okay, cool.
Perfect.
Okay, hello, everybody. Good evening, good morning, and good afternoon. So today I'm going to talk about the job readiness journey. So from academia to industry. So before starting on this topic, I'd like to give a gist of my life journey so that it is easier to understand why we are doing this, right? So I come from a very small town and I did my education in a tier two town. And then when I came to the industry, um, I was pretty much super alien to the industry environment, right? So I had to do a lot of course correction, learning stuff, unlearning a lot of things. And most often when I started like 25 years ago in the industry, internet wasn't that prevalent. The cost of going to a cafe was expensive, and then we had to go to flea markets to buy the books, and then we had to do it. And the first time I saw the Black Linux environment, I was super excited, but then there wasn't much I could do because I could see my colleagues doing something else. They were all pretty seniors, and I was a junior employee there. And I had to go to the book was costing about 50% of my monthly salary. It was an imported book, so I had to get it to learn, right? And even today, the I don't know if to call it whether it is sad, but then a lot of the tier two, tier three colleges are stuck in some old curriculum, and then most of the folks who are teaching have never been in the industry, and still people do teach the same things. And because we know, like when we have been hiring throughout, and we know, like when we hire people, we have to retrain them, reskill them, and then put them on the projects. And if you see, the lot of degrees that I have is because education can change life. And once you get a job, it doesn't stop there. You continuously keep upskilling so that you can move up in the ladder and then do whatever that you want to do. At least you do not have a barrier to try out whatever it is. In today's world, um, education is so this information is so much, you don't know where to start, what all to cover, and where to end to say that I know this topic and then I can do something out of it, right? Because every other information is like all over the place, and it becomes very overwhelming for somebody to do it. And then most of them are video courses wherein you're learning tech, you're following video, you're switching tabs, installing something. And some of the tier two, tier three folks do not have a proper laptop where they could install, or even employees who want to learn, they have company policies on the laptop, so they're not able to install. So this is what we wanted to bridge in terms of, okay, I know something, am I job ready? Will I be immediately deployable? And will I be able to contribute, right? The other question we have is, okay, now that AI can do this thing, I don't need any entry level person. 5 years later, what will you do for an experienced person when all the folks retire, right? So we'll have to have some entry level folks trained to take over from the previous generation who has been doing a lot of stuff. Now, who is going to reskill them? Because it is not going to be easier for somebody to come in, because AI can generate code and they're testing it and putting in and then moving on to production, and then production breaks, right? But then how do you debug that? The AI generated the code is most obfuscated code that you get, but then you will have to spend a lot of time to debug it if there is some issue. And if you haven't learned the fundamentals of that, it is going to be very difficult to debug, right? These are some of the challenges that we want to address and ensure that there is a smooth availability of talent, and the talent gets deployed properly, and the job creation happens so that the youth is directed in terms of whatever they're supposed to do instead of doing something else, right? This is what our goal is. And Aivagam is a Tamil word, which means laboratory literally. And we didn't want to do video courses. We wanted to make sure the Linux is accessible to everybody. where they can play around with it and be done away with the fear of seeing a black screen. And when we designed it, this is the world's first hands-on labs with guided instructions, because this gives you a hand-holding immediate feedback mechanism for you to learn and say, okay, this is where I'm starting, and this is all I'm covering, and this is where I'm ending. So I know I could be able to go ahead and do something productive immediately, right? For example, when a fresher joins a company, they take about 3 years to understand what happens end to end, because they are given small tasks, and then they are given something in terms of, okay, some documentation work and something which is very not related to work in the beginning, and then slowly they get absorbed into the work. So it takes like 3 years for somebody to do it. In today's world, okay, tier 1 good colleges who have been doing self-learning, they do it, but not the 70% of the graduates who graduate today, at least in India, they're not employable. The larger reason is people go for computer science, but after completing their engineering, they can't code. And then they come back to the cities, and then they spend a huge amount of money just to learn JavaScript, right? This is what we want to avoid that. And then and they are all costing a bomb. So we wanted to do an affordable model where anybody, even on a low-cost laptop across the world, gets quality access to the OS or code editors or whatever they have to do. We are providing them. For example, we have a full stack development lab where they are hand-holded and they will be able to learn Node.js and then write APIs, deploy them on the cloud, and then write the front end using React.js and do a capstone project. And we also have a capstone project which connects to Gemini API for them to write Gen AI code. So all this in the form of a lab. So you don't have to worry about, okay, I need 3 years for me to gain the experience or whatever. In like 4 weeks, if you complete the lab, then you get to know in the first 3 years of your life what you're going to do, right? That is why this platform is patented. Usually in India, getting a software patented is very tough. We got it patented, and we also have been in the finalist for the edX Awards from London. And most importantly, we wanted to do away with the passive learning. So this is the real world problem that we have. So most of them say that, hey, your courses in terms of whatever that you are providing, it is not videos. For what do we do with that, right? Now we tell them that, okay, you can go hands-on practice, and then you can go and do it, and then you can learn it, and then you can go and get the certification. So we are NASSCOM certified. Once you finish, you get a NASSCOM certificate, and the ID is there where somebody can go ahead and then verify from our platform. Those things are there in place, but what we really want to do is once you finish your course, you do not have to search for a job. For example, there are a lot of sites which post freelance projects. You should be able to build something. And Government of India has a lot of startup boost in terms of grants and everything. So if you have an idea, you don't have the money, you just need how to build it, then you build it on your own. That is what our goal is. So we are creating job creation so that people can be rooted where they are, and then they can go ahead and build systems from there. A lot of times when the placement do not happen, with all these new age jobs, like for example, delivery, people who complete engineering, there is nothing wrong in that. But then the growth, what they are looking for, eventually the burnout will set in. Hey, I did this, but I'm doing this. What am I even doing in my life, right? So that is why we wanted to ensure the education reaches to the root where they can do something and they can also afford to get educated, whether they don't have time to go to a night school or a weekend class. They can just do it from here at an affordable cost. And then we provide quality containers so that they can practice. And even, for example, one of the labs that we have is the Git. And most of them do not get to use Rebase at all in their whole life, right? But you can use Rebase and then see how the Rebase works. A lot of experimentation can be done. So that is what we are aiming for. Most importantly, there is a national education policy which is giving a lot of boost for faculty development program. This is one of the things that we have also picked up in terms of academy. We realize that, okay, the teachers have to know what to teach. So we are now government is giving a lot of push for training the teachers. So we have been part of the program, partnering with some partners and then doing the trainings for the teachers so that they realize, okay, these are some of the things that are latest and this is how it is done in the industry. So they can take it back. For example, if you train a trainer in a class of engineering class, there'll be 60 students, right? So a teacher can go and deliver it to 60 students. So that is what the scale that we are looking at. If in a class, 60 staff sit and get trained by us, and each of the staff goes and trains 60 more, right? So that is the impact that we are looking at. And most importantly, the lot of jobs that are there, and most of them are like very temp jobs. And if they want to do something in terms of the fulfillment of what they want to do, most of the times they have no clue on what to do, and that is what we wanted to eradicate. Some of the folks have a lot of good ideas, and we have several WhatsApp groups looking for founder, CTO, architect, all of these things, right? But then when the technology is taken to the cities, from the cities to the towns to the villages, what happens is the pay parity is going to vary, right? And again, the living cost is also adjusted. But then for them to do from whatever they want to do from their original place, without moving the base and still lead a fulfilling life. And today you can do remote everywhere because it is tech. You can even take a project from abroad and do it on your own as a freelancer. So these are the things that we want to enable instead of people going and finding a job for themselves. And also when we do the sessions, particularly we identify potential candidates in terms of, okay, this person is good. And we are also placing them on all the consulting projects. And because of the kind of time that I have spent in the industry, we are using Connects to place the people once they get trained. So this is what we are trying to address. So mostly we are different because all of them are browser-based labs, zero setup. They're real tools. And then role-based tracks. For example, if you want to become an API quality engineer, there is a learning track for them. Full stack developer, there is a learning track for them. Playwright test automation engineer, there is a track for them. Machine learning, we are loading Jupyter Notebook on the browser for people to learn with a similar feedback mechanism. These are some things which has not been problem solved in the industry, where it can be made affordable for people to go ahead and try out. Okay, what is the sequence of doing that machine learning? There's a lot of talk that is happening, but how do I go and try it out on my own? So the platform provides you the tools for you to try with guidance. And they exactly are guided to in terms of where to start, what to cover, and where to end for me to claim I know this topic, right? That is how the content is also done. So instant AI feedback, and mostly in terms of the certification, we already spoke about that, how they can come and validate the certification on our platform. And mostly we are looking at ownership of doing things versus observing, just watching something and then understanding it. When you do something, it becomes much more clear. Because the way that we have done is, when we had this platform, when we went to our counterparts for us to show that, okay, this is what we have done. Rene, we have a problem. Why don't you pick it up and do it yourself? So the projects have come because we have been able to train our own folks, and then we are going to place them in the projects. So one of the things, when I mention EdTech, most of them run away from that, because EdTech is something which is very difficult to deploy as a startup, right? Because education is considered sacred, and a lot of times we do not want a lot of cost on education, because it's one of the drivers of the people getting upskilled and then to better their lives, right? At least in India, education is a goddess. We worship in terms of whatever the sacred attention that is given to the education. So what we were trying to do is, we were wanting to be affordable, reach out anywhere, and then they should be able to get a job at the end or do something on their own, just to eliminate the fear of, okay, this is tech, it is not for me. There are a lot of students we have who have come and said, this is not for us and this is not, and the parents have convinced, and then they have left the scholars with us and they have upskilled and we have placed. And a lot of times with all these startups going bust, in 1 or 2 years, people lose jobs. And then when they lose jobs, it's very difficult for them to find, because in the 2 years, they have not done much, especially if you join a startup. Most of the seniors write code and the juniors all write supporting code for that. The core piece is resolved by somebody who is pretty senior, who's written that. So what happens when these people come out and they do not have jobs? It becomes very difficult for them to attend an interview because they have not seen an end-to-end cycle and they have done work from home. And it is very important, very difficult for them to articulate some of the things because they have not heard those things. So in our labs, we have a voiceover explaining what each of them does, so they can wear a headphone and then do it. So what happens is we have built our own consulting. This is the automation we have done. Lot of edtech stop with edtech and placement. And placement is most often not considered in terms of giving employment to everybody, right? They arrange interviews and stuff and things like that. But what we are doing is we are automating the edtech, and we have a hiring platform where people who finish the labs come on to the hiring platform, or whenever we float a job description, when people apply, we pick the people who do not have jobs. That is where reskilling comes into place. We pick those people, we train them, reskill them, and then we place them on their projects. And finally, what we are doing is we are placing them on consulting projects. So the whole automation in terms of end-to-end delivery of edtech is what we are looking at. And that is how we remain bootstrapped to this day, because whatever we are giving to our scholars, we ourselves are using it to grow our teams. So this rapid skilling has, for example, I can give you a number. Like last March, we were 3 folks, and now we are close to 50 folks, right? So in 12 months, we could onboard 50 by training them and placing them on projects. So this is something which we have seen, which the colleges have seen, and which the training partners have seen. And some of the startups who do not have funds to train their interns have used the platform, and then they have also benefited. So this is the one that I was talking about. The close to job creation, the last part where I have here in terms of the franchisee model is we want to enable the people micro entrepreneurship, because we have labs, we will train the trainers, and then we'll take the labs closer to the tier 2, tier 3, where people can get trained. There are a lot of local businesses which are getting digitized and automated. So they can play a good part in digitizing the whole of the ecosystem. So that is what our goal is. Mostly people measure in terms of, okay, how much revenue I made and things like that. We are running on revenue. We don't have a problem. What we measure is in terms of metrics is how many of the labs are getting completed. We have video courses have 17%, you know that, but then our labs have 87% of completion rate, because it triggers the curiosity in the person for them to go ahead and try what is next. And because we build a story out of the labs for them to do it. Post that, what happens is we want to train the people, and we want to enable folks to go and deliver the correct in terms of the information for them to be empowered, so they could go and do their own freelance work, so that everybody is self-equipped. So this is why we say the 3 years of experience in 4 weeks. If you want to learn something like, for example, machine learning, in 2 days, you can learn statistics for Python with statistics, and Python for pandas, and machine learning. You can just glance through it and you'll know like what are all there. And if you want to learn Python in like 3 days, you should be able to learn. Every course has a beginner, intermediate, and advanced. So this is how we have been able to enable the people with tech enablement. And why now? Because AI revolution, everybody is running like headless chicken in terms of what to learn. There's so much to learn. We want to streamline and get the focus in terms of getting the fundamentals right. Jobs, there are plenty, we are not able to hire. And there are also people who are being laid off. So there is a balance we have to find, and make sure everybody has a play in that. And Startup India, there's a lot of, we ourselves have gotten 3 grants from the government for us to build this platform, apart from our own funds. It's been very helpful for us because they also help us to do the outreach in terms of either doing faculty development or reaching out to the colleges and things like that. And because of remote work, now nobody has to travel somewhere to find if they have to go find a job. And if they are really good, they send the assessment and people clear the assessments and then they get placed. So this is what our goal is in terms of educating leveraging the opportunity that is available today. So ours, like I mentioned, we have real world job paths. Assessments are also hands-on. In assessment, the guidance instructions won't be there. Only the question will be there. Out of things, whatever you have learned, you have to clear. You have to get 70% for you to clear the certificate. And of course, we have a hiring platform. So once you finish a lab, you get onboarded to the hiring platform. So your hiring partners can see what the score is and they can ask for the people to be hired. So these are some of the early wins and impacts that we have created. The proof that whatever we have been doing for the past 3 years has given us good satisfaction in terms of what we set out to do. We have had cushy jobs, we quit, and then we started this to make a difference. And whether we are making difference, when you look at the slide, I feel very happy that we have been able to do something in terms of making a difference in people's lives by transforming their lives, by giving good quality of life, by getting them into good jobs and giving them satisfaction of, okay, I created something, and then giving them the satisfaction of, okay, I can take care of my family, all those things, right? So we have 99% feedback, and we have created micro entrepreneurs, and where there are B2B customers with us. And most importantly, we run a community, and most often we give away our labs for free for women on break from IT. And if they come and reach out to us, we give the labs free so that they can do it from home. And we have created internships. So these are specific internships from our company, but across we have given a lot of internships for people. We claim that if you finish our full stack lab, we are your first real world job experience, because you're building a live application as a capstone project without leaving the browser, right? So these are some of the things that we have done. So beyond training, we are trying to build an ecosystem. For academia, we are doing faculty development plus placement. For industry, pre-trained hands-on experienced entry talent. For policy, workforce development model, we work with the government and then we enable a lot of things. For entrepreneurs, they don't have to build curriculum or something like that, so they can use, there are centers already there, but in terms of teaching stuff, they're always struggling to find out what to teach. And because we have the projects also running in that, real-time developers and architects go and do an orientation session at the end of that. If for example, a class of students are doing these labs, an additional orientation is done for them to understand why these things are there and how real-world applications look. And we help them to set up on their local laptops for with a PDF they can do it, or we go and do it, because when people pay, we take extra care and go and do that. So we are not just building courses, we are accelerating real capabilities. We are not pushing content, we are simulating contribution. Like, for example, there was an incident where the QA team was trained on test automation on Python. And they were able to, after the training, they were immediately able to participate in the sprint, right? Otherwise, they come after the sprint where they come only for the testing. They could automate the APIs, they could test the APIs, they could parse the JSON. All of these are taught in the labs. So this is what we wanted to do. Reimagine readiness in terms of they're equipped well, and they have the depth of information. And we want to give dignity when people start, that equip them with the right set of skills for them to go and do whatever they are able to do in terms of whatever they have gained in terms of the knowledge. So I have included some screenshots because it would be very helpful to see like how the screenshots look. This is what a learning path is. So I was saying beginner, intermediate, and advanced. and then a TypeScript, and then we teach the whole path for somebody to become a playwright test engineer. And similarly, there are some playway game methods to understand how to do problem solving without coding. And then similarly, all of them, wherever it is code editor, even DB, if you want to learn queries, you don't have to install a DB or practice anything. All the data, everything is loaded. And and this is how our platform looks. The console gets displayed here with the instructions are here, and the ticker runs here. As and when you finish, the guidance goes here. And this is a lesson plan. It gives an overview of what you're going to learn in terms of lesson plan. And you see a small blue bulb, that is our AI chat. This is our own in-house chat where when people get stuck with respect to this particular lab, the AI can help them to understand what is going on and how to course correct and do it. And if you see the SQL data model is also loaded so that they can see and do complex joins, complex queries, and then learn like how things work. So this is my last slide. If there are any questions, I can take them.
All right. Fantastic. What a very great topic. Like this actually would remove it could possibly remove the anxiety of freshies for those who just recently graduated of where would I work? Like how do I land a job? And how would employers hire me? Something like that. So especially in tech industry because the actual competition is on a different level, right? So this platform, this application, or this actual service would be a great leverage for those fresh graduates on tech industry because it will teach you a lot of things that you cannot just handle in or you'll not be able to get your hands on in any university as of the moment, right?
Yeah,
So this is a wonderful initiative. Thank you for
thank you
this
very
for
much.
bringing this one in the in Let Us Talk It Zipinar, right? So in case you missed this video, this actual session itself is very helpful and you might want to share in your socials as well so many would get the information and because this is just the uh, the the topics discussed right now are just the tip of the iceberg. So you want to get in touch to the actual guest speakers for you to learn further and understand more about what they have shared. All right, so make sure you connect with them and yeah, while we are waiting, if there are any questions from our attendees, please feel free to type it in, or anyone from those who are watching live, you can actually put on your questions there, the chat or comment section. So, Dr. Renee, how would they get in touch with you to be able to keep in touch with the information, how like the progress, and also if you have any upcoming online like free event as well, you can promote.
Thanks, Phil. So I am reachable on LinkedIn. My coordinates are available. So you can always connect to me on LinkedIn and then ask any question. Uh, Also, I do a lot of career coaching in terms of the candidates who really have the fire and thirst for them. And we also have done coaching for engineering managers to become directors. So that is also something we have done. But mostly these are done one-on-one and specifically what the person is struggling. You'd love to do that. And most of the sessions are on a private Zoom call, so I'm not sure I can share them. But we do run community events. Nothing planned for this fortnight. But end of the fortnight, we are planning something for our. We have an 800 member community where we also have a lot of groups. So one of the groups is Women on Break. So we do a lot of information sharing for people to attend the events. So when the event is out, I'll share you the invite. You can post it and people can get onto the webinar.
Perfect. And also for those who are watching, it's much better if you're able to be part of the connection network of Dr. Renee. So if you are interested, especially if you are in the tech industry. So yeah, to get access or information, you can check on the website Aivagam. So it's AIVAGAM.topgrep.com. So top TOPGREP.com. So make sure to save that one and take a look. So if you're in the tech industry and you're just new, make sure to get a glance on that website. All right. Yes, any further questions from our attendees, opinions, additional inputs? Okay. No one in live so far with a question as well. But again, as mentioned earlier, if in case you are watching the recorded session, you can just leave your questions or message on the chat section and we'll be sure to bring them forward to our guest speakers. All right. So I guess if there are no questions or no further questions, we can conclude today's webinar. So great appreciation from Latasaki team to Sir Prem and Dr. Renee for such great topics that you have brought, and it's very timely, relevant, and as well, it's pretty much like feeding the information. Though it's just a short time for you to share your topic, but we'll be sure to invite more people to check on your socials, definitely to gather more informations. And for those who are watching this recorded session, make sure to share this into your socials as well. So it will help the information reach much farther and also give more visibility to our guest speakers. So they'll be invited to different platforms and impact the world as well with their knowledge and best practices. All right. So this is again Let Us Talk It, and we would like to invite you again next Wednesday. So this is every Wednesday, the same time. That's 12 noon to 1 p.m. Eastern time. And we'll bring you two new topics as well and two guest speakers. All right. So this is Phil again from Let Us Talk It. And we would like to give our great thanks to our guest speakers and for those who have attended, for those who have watched live with us, and for those who will be watching this recorded session later. And again, don't forget to share. All right. So thank you so much, everyone. Thank you so much, Sir Prem, Dr. Renee. Thank you for joining today's
Thanks,
webinar.
Phil.
And
Thanks, team. Thanks, everyone.
thank you, everyone. Take care as always. Goodbye for now.